All right, moving into today's COVID report. Today we are reporting 884 new cases of COVID-19. That brings our total number of cases to 77,455. This is about 20 cases less than we had this day last week. It's about 200 more than we had in the 2 preceding weeks before that. It gives you an idea that, again, even excluding some of the backlog cases that came in yesterday, we are unfortunately on track to have the single largest week thus far in this epidemic. Our positivity rate, though, continues to stay certainly under 5% and actually creep down a little bit to 4.1%. Now, there were some questions the other day on positivity rate. We're going to talk about it in detail next week, but I had a chance to clarify with the Department for Public Health, and they are different data streams than the number of cases that come in. The number of cases are cases that have gone through the local health department. They have an individual name and person associated with them. The positivity rate is calculated by the reports from labs that come in, the total numbers they have plus the numbers of positives that they send in. But we're going to break that down for you next week and also show how we have been following kind of the total numbers that we have with what's reported electronically, and they are tracking very, very closely to where we have real confidence in this number. New cases by county: Jefferson 161, Fayette 48, Davis 34, Hopkins 32, Henderson 31, Whitley 28, Warren 25, Callaway 22, Hardin 22, Laurel and Madison 19, Jessamine 17, 13 in Bullitt, Kenton and Nelson, 12 in Ohio and Scott, 10 in Barron, Graves, Letcher, Marion, McCracken, and Webster. So a number of those counties haven't necessarily been in the double digits in the last several weeks, but again, COVID is everywhere, and it doesn't take much to have an outbreak where we see a county then for about a week in those double digits. Tough day today in terms of Kentuckians lost. We're reporting 11 Kentuckians who have died, at least in part, to COVID-19. Again, with the high number of cases, we're going to have high numbers of deaths. Even with the mortality rate decreasing, it's still at a significant level compared to anything we normally deal with. Today includes a 62-year-old woman from Bell, a 95-year-old woman from Boyd, a 60-year-old woman from Bullitt, an 80-year-old woman from Fayette, an 85 and a 63-year-old woman from Jefferson, a 58-year-old man from Jefferson, a 65-year-old man from Lincoln, an 86-year-old woman from Scott, and an 83-year-old man from Scott, and a 31-year-old man from Warren County. And there are certainly other health conditions that individual was dealing with, but COVID-19 was certainly an impact on his passing. That's 11 Kentucky families, so please be there for them. Show your empathy. Be the great Kentuckians that we are. Light your homes up green, because you never know who's driving by at that part of the night or that part of the morning. That may just help them know that you're out there and supporting them. And let's make sure we continue to ring those bells at 10 a.m. Every morning. If you know any of these families, please reach out. Tell them you care about them. Tell them they're not alone. If they need somebody to talk to, you're there. We've been there for each other thus far through this. I know that we will continue. Long-term care, which is the only area that we're going to have the update on today. 69 new residents, 62 new staff testing positive, 5 additional deaths that we have previously reported attributable to long-term care. The situation in our veterans home that we have been reporting about in Wilmore has gotten a little bit worse. We now have 33 veterans who are currently dealing with COVID-19 from that facility, and one is recovered. So there have been 34 positive veterans in that facility. We have 10 staff that are actively fighting COVID-19 and 5 that have recovered, so that means a total of 15. 10 of the veterans that we talked about are currently at the VA getting the extra care that they need. We are marshaling all of our resources to be there for them.